You didn't see me this morning. I'm the Director of Training at the UCLA Integrated Substance Abuse Programs and also the Director of the Pacific Southwest Addiction Technology Transfer Center. And we developed the materials that I'm going to present to you today in association with the AIDS Education and Training Center located at Drew University. And this is a hot topic, isn't it? Right? Medical marijuana. How many of you know someone with a medical marijuana card, a patient or a friend? Yeah, that's most of the people in the room. Surprise! So the question is it okay for them to use marijuana for medical reasons? My answer is it's complicated, right? There isn't a good answer to that. And so what you're going to hear me say throughout the course of this session is there's no right or wrong answer in terms of marijuana use as it's applied to medical marijuana. We're going to talk specifically about the mechanism of action of marijuana. It's a weird room too, sorry. The slides are over there, I'm over here. Feel free not to look at me. We'll describe the mechanism of action of marijuana, how it works in the brain, and then we'll talk about the effects of marijuana on people's health and whether or not it's okay to use for medically. What does it make sense for to use medically, and what does it make not so much sense for? Someone had an indication of use for eyelash pain. I kid you not. That would be one of the not so good reasons for using marijuana. And how can we begin to have a positive impact on that? So we're going to start with just some general information about marijuana. So when you think of marijuana and marijuana use, who comes to mind? What kind of people use marijuana? All kinds, yeah. And that's generally the answer that we get now. It used to be that it was the hippie, right? Or the stoner kids in high school. They'd be out smoking marijuana, but it was a very specific type. But now we know a broad spectrum of society, maybe because all those hippies have grown up and it's just much more accepted now, but there's a broad spectrum of people who are using marijuana. Just a couple of examples that may not fall into the typical category. Maria and Terry are a married couple, 46 and 48 years old. They used in college and stopped when Maria got pregnant. They now smoke socially or when they go to concerts. Maria uses when work stresses her out, and Terry uses for pain stemming from HIV-related neuropathy. Complicated couple, right? We don't know about Maria's serostatus. Maybe they're seroconcordant, maybe they're serodiscordant. But lots of issues that need to be dealt with to figure out whether their marijuana use is good and medically advised or not so good. Elise is 78 years old. She never used marijuana once until she was 63 years of age. She first used to improve her appetite while she was getting chemotherapy for breast cancer. The cancer is now metastasized, and conventional painkillers are not helping her, so she now uses marijuana several times a day for pain relief. Is marijuana okay for her? Is it a good treatment for her pain? And should we recommend, if you're a physician, should a physician recommend that she continue to use her marijuana? The answer? It's complicated, right? And we're going to explore those issues. So marijuana is the most commonly used drug. In some places, the most commonly used drug. In other places, second only to alcohol in terms of its use. Certainly the most common illicitly used drug. In 2008, only about 6% of people aged 12 and older were using. That rose to over 7% in 2011. 19% of the population between the ages of 18 and 25 report using marijuana. And half of adults in the US report using marijuana at least sometime in their lives. So it's really common. In fact, it's more common than not using in many places. Why do people use? Well, if you add up the green and the blue numbers, that's the people who use for fun, or they use for fun and for medical reasons. That totals 70% of people. So 3/4 of people are using for recreational purposes. Another 50% of those, with some overlap, are using for medical purposes. When is it okay, when is it not? It's complicated. So what are we talking about? Well, marijuana is the dry shredded leaves of a couple of plants, Cannabis sativa or Cannabis indica. They're both subspecies of hemp that are common throughout the world. They contain over 400 chemical compounds each and go by a variety of different street-level names. It can be used in a few different ways. It can be smoked in a pipe or a cigarette. When smoked, its effects are quite rapid, but we know that burning marijuana produces toxins that can lead to pulmonary issues and some other issues that we'll explore along the way. A lot of people extol the virtues of the vaporizer. It's inhaled through a machine that converts it into an inhalable form. And again, you get the same rapid effects that you do from smoking, but not necessarily health-improving effects. And they're finding, that you find less kinds of toxins in the vaporized version, but there's some question now about those vaporizers and how effective they are in truly removing all of those toxins, and whether or not it eliminates the pulmonary issues. You can eat it, you don't get the pulmonary issues that way, but it takes a lot longer for the chemicals to work their way through your bloodstream and get to your brain. So the onset is slow. But again, it doesn't release those toxic chemicals that lead to pulmonary problems. Some other forms that are not just the leaf, there's hashish, which is the compressed resin from the plant. It's more concentrated and more potent than the marijuana leaf is. And so people will need to use smaller amounts in order to get the same intoxicating effect. There's also hashish oil, often called wax, where they extract the psychoactive chemicals out of the plant and mix it with butane. Now this is really potent, 3 to 4 times as potent as the marijuana plant. And then you've probably heard about some of the synthetic marijuanas as well. Spice or K2, they're quote unquote herbal mixtures, or they're really chemical mixtures that operate on the same receptor sites and therefore produce effects that are similar to what we see with marijuana. They're working really, the federal government is working really hard to make the chemicals that go into spice and K2 and similar compounds illegal, and they've made the 5 most common illegal now. But the darling little street chemists who are out there always trying to find another way just keep finding new compounds that operate on the same thing. And so just like when GHB was on the street and they were trying to make it illegal, they're staying just ahead of the law frequently. And so you can still walk into a head shop and often buy these compounds or similar ones. So how does it work? Well, there are over 60 cannabinoids that are the main active chemical in THC. THC is the active ingredient that makes you high when you smoke marijuana. The high is triggered by operating on the receptors in the brain, the cannabinoid receptors. Isn't it interesting that we have receptors in our brain that are set up like lock and key for cannabinoids? Now we have some naturally occurring cannabinoids that exist within the brain, but no one's quite sure why those receptors developed the way that they did. But they're responsible for feelings of pleasure, for memory, for changes in thinking and concentration, and for some changes in coordination as well. So THC is similar to the naturally occurring compounds that exist within our brain, and those seem to most predominantly affect pain, appetite, and the vomiting reflex. And so we know from some clinical examinations that marijuana is particularly good from a medical perspective on those particular issues: pain, appetite, and suppression of nausea and vomiting. And the effects generally last from 1 to 4 hours, in part dependent on the concentration. Now, the effects that you get here, these are the common effects that people report when they use marijuana. But the effects are different depending on the strain of the plant that you get. Sativa plants are more prone to producing euphoria and stress relief, whereas the indica plant is more likely produces relaxation and physical relief or pain relief. So what they'll often do, distributors will often do, and they do this in the dispensaries as well, is they'll mix sativa and indica to try to address the particular symptoms that the person is reporting. If it's more pain, they're going to go higher on indica. If it's more anxiety and stress, they may go higher on the sativa plant to try to maximize the chemical benefit associated with each of the strains of the plant. So the effects, the negative effects are similar to other drugs if it's misused. You can see long-term negative impact on learning and memory. There's also this classic amotivational syndrome, and it used to be kind of thought to be an urban myth that marijuana takes away your motivation. Turns out not so much a myth. It actually does seem to lead to this syndrome where, yeah, I should get something done, but maybe tomorrow, right? Not so much going to do it today. It's unclear how marijuana is associated with a variety of mental health related issues, but we do know that heavy use is associated with severe mental health issues like psychotic problems, particularly in young people. And so it's unclear whether those were existing psychological problems that are exacerbated or sort of the break happens because marijuana is being used, or if the marijuana is actually causing those problems. But we know high use is dangerous in that way. And it's smoked. It's really hard to say, yeah, it's good to take a medicine by smoking, right? Now, again, it's natural, it's herbal, it doesn't do me any harm. You've heard this, right? Well, according to the studies that have been done, one joint does as much damage as 4 to 10 cigarettes in terms of the stuff that it's putting into your body. So you see increased risks of bronchitis, emphysema, and lung cancer. And it has significant cardiac implications. Use of marijuana raises blood pressure and heart rate. Your heart rate can go up 20 to 100%. And after someone has smoked marijuana for that hour after they've just used, they're 4.8 times more likely to have a heart attack than at any other time. So there are significant cardiac implications. You know, natural, herbal, totally safe. Not so much, maybe. The other rumor that's out there is that it's much safer than alcohol during pregnancy. I think during pregnancy, we should probably limit all of those kinds of things that we're putting into our body, but there's increased evidence that prenatal exposure does indeed cause harmful effects. You see an increase in motor, social, and cognitive disturbances in infants who are born exposed prenatally to marijuana. You see a higher number of low birth weight infants for gestational age and an increased rate of childhood leukemia in kids who are exposed prenatally. And it is found in breast milk. And so the levels are generally considered subclinical that the baby would be getting through the breast milk. But if you have a woman who's breastfeeding and using marijuana, you should encourage her to consult with her pediatrician about the appropriateness of that for her in relationship to the health of her baby. Yeah, does smoking through a bong have less of a negative effect than smoking through a joint? I haven't seen that reported anywhere. Smoking, bad. That's what it seems to say. Yeah. Again, that's what a lot of smokers say, that I'm filtering it through the water, but I haven't seen any studies that demonstrate a difference in how you smoke it versus the negative effects. What's the risk of smoking the wax, which has butane in it? Yeah, again, because it's hard to study because it's all this illegal stuff, right? So I don't know of any formal clinical studies that have been done, but breathing in burning butane seems not good, right? Stick your head in a gas fire and breathe in, right? It's kind of a bad idea. So we know that any kind of volatile substance like that, when it's burned, produces noxious chemicals that can cause damage to the lungs and other tissue. So we can assume, although we don't have data to back it up necessarily, that it's not so good in that form either. So people use for a variety of different reasons. To start with, maybe just to fit in or to have fun, to socialize, and to cope with physical or emotional discomfort. They keep using it because it works. It does alleviate emotional and psychological distress. It does help with pain and discomfort. People do report that it feels good and it's fun. And if they've used a whole lot, they're afraid to stop. It turns out that the marijuana that I wasn't smoking when I was a kid was a lot less potent than the marijuana that exists today. And that marijuana that used to be there a long time ago, the doctors were probably right. It probably didn't produce physical dependence. But the marijuana that's out there today does have a pretty classic withdrawal profile. So it does have the potential for abuse and dependence, including physical dependence, in a way that really probably wasn't true 20 years ago or so. So we know that we're impacting the receptor sites, and marijuana use undoubtedly changes the way that the brain functions because of the repeated assault on those receptor sites. Marijuana use is more common among individuals who have mental health disorders than among people who don't, so we see higher rates in that particular population. In 2011, 23% of people who received addiction treatment received treatment for marijuana use disorders. So it's among the most common reasons why people go into treatment. The average adult entering treatment say that they've used daily for 10 years and tried to quit 6 different times. So they seem to want to quit pretty bad, which says maybe it's not working for them as much as they want. And it's clearly not easy to quit. Now, I think this slide is really fascinating. This shows of anyone who's used this drug even once, what is their lifetime risk being dependent on that substance? So if you've tried nicotine one time, your lifetime risk of dependence is about 32%. With heroin, it's about 23%, with cocaine, 17%, with alcohol, 15%, and with marijuana, only 9%. If you've tried it once, only 9% go on and develop abuse or dependence. Well, if it's hard to become dependent on, why is it the number one illicit drug that people are going into treatment for? Any ideas? What's that? Maybe masking the problem. Good, but remember, they're going in specifically for marijuana dependence. It's easy to get, which means a hell of a lot more people are using marijuana than are using heroin, right? So 9% of a whole lot turns out to be more than 23% of a few. So we've just got more exposure leading to more people coming into treatment. Most people use without ever developing a problem, at least a diagnosable problem on marijuana. Although problematic use may be more widespread than is documented because we don't really have any way in our systems up until sort of the proliferation of screening and brief intervention of identifying people who are using problematically but are not yet diagnosable as having abuse or dependence. In LA County, marijuana use accounts for more substance use disorder treatment admissions than any other drug, including alcohol. So 23.3% for marijuana versus 22% for alcohol. No one seems particularly impressed, but I thought those numbers were amazing. So signs of abuse and dependence, we do see specific signs of tolerance. That is withdrawal if someone stops using suddenly. The withdrawal symptoms, to answer your question, sir, anger and aggression, a decrease in appetite. You know, you get the munchies if you smoke. Well, it lowers your appetite when you stop suddenly. Increase in irritability, nervousness and anxiety, restlessness, sleep disturbance, and strange dreams. And then you get the other symptoms that you expect with any drug: preoccupation and craving, loss of control, continued use despite negative consequences, and denial or cognitive distortions. Now, people will often say, I use marijuana because it really helps me with my anxiety. Or it helps me go to sleep and it helps me sleep better. When you look at that, does it seem like a good idea? Because one of the withdrawal symptoms is the opposite of what they're trying to treat. So it turns out marijuana has a rebound anxiety effect where it'll quell anxiety to begin with. And then when you stop using, boom, you get a bolt of anxiety that's worse than when you started. So how do you fix that? You use marijuana, right? And you end up with this vicious cycle where you need marijuana in order to keep the anxiety at bay, and we see the dose go up and up and up. Likewise, that anxiety, that rebound anxiety, leads to sleep disturbances. So if someone's saying they're using marijuana to help them sleep, again, it's probably a bad idea. It may work initially, but it's not going to work over the long term because of that rebound anxiety effect. So people who use marijuana need treatment, just like everybody else needs treatment. Hopefully, it's good evidence-based practice treatment. There's a few examples that are up there. There are others that are available. About 10 to 30% achieve abstinence after 1 year. You may think those numbers are horrible, but they're actually comparable to what we see in diabetes and hypertension as well. People resort to old behaviors. They don't control their diabetes well, they don't control their hypertension well, and they don't control substance use disorders well either. But those numbers are actually pretty good compared to what we see with other chronically relapsing conditions. And we don't have any medicines that have been shown to be effective to help people who are using marijuana. So what we do is we give them good behavioral treatment and try to move them to other ways of coping with whatever problems they're dealing with. Here's the slide I was referring to earlier. It's not your dad's pot anymore. This is 1980. That's 2007. We see a 151% increase in the amount of THC that's present in the plant across that time span. Genetic engineering is a wonderful thing. And so they can actually create plants that have ever increasing amounts of the intoxicating substance that's there. There have been studies that show that long-term marijuana use makes you more anxious, that you don't stop, but you just get increasing anxiety. Unfortunately, I haven't seen that study. Again, it's hard to study something that's illegal and be not illegal at the same time. We'll talk about that in a minute. But what we do know, thank you very much. What we do know is because of this rebound anxiety, we'll find that people use more and more, use more regularly, and move toward becoming daily users who are using marijuana for anxiety purposes because of this rebound effect that we get. So we see a lot of people who use in order to stem the anxiety, and they keep using because as soon as they stop, the anxiety comes back. Now that's clinical anecdotal evidence. It's not research evidence, which is what we'd really like to see, but at least there's some indication that that's probably true. Sorry, we can't answer it better at this point. So if you, to repeat, if you don't learn good coping as an adolescent, in part because you're using marijuana, marijuana becomes your way of coping. And so it's your go-to when you start experiencing anxiety and you don't learn other kinds of coping mechanisms. So one of the things that we'll wrap up our talk with is teaching people basic coping is one of the ways we can help them if their marijuana use is becoming a problem. Basic coping with what? Anxiety, sleep problems, pain, the things that they may be using to treat it with. If you're withdrawing from methamphetamine, for instance, you have a tendency to go to sleep and be really tired. You're not particularly anxious. Anxious while you're on the drug, the opposite while you're off of the drug. And so it really depends on the pharmacokinetics, how the drug works inside the body of that particular compound as to what you see as you're coming off of the drug. And what you see is the opposite of what you see when they're high on the drug. So if it speeds you up, that's very akin to anxiety, and you're going to see that go away, and you're going to see lethargy and tiredness in withdrawal. If it slows you down, all those compounds, you're going to see some of the anxiety. But it's particularly profound with marijuana, the rebound effect, with marijuana and with benzodiazepines. You see rebound anxiety with both of those that are more significant, for instance, than you see with alcohol. So how can this drug that we're talking about be used as a medicine? Well, we've actually already talked about it. It does some things that we want to see from medicines. It causes relaxation. It impacts the way we're thinking. It may impair coordination, but it's great for pain control, appetite, and vomiting. So medical issues like cancer, which we know is associated with pain, and many of the treatments are associated with severe nausea and vomiting, and therefore weight loss all the way to anorexia, can be greatly helped by a compound that helps someone eat, feel less nauseous, and reduces their overall experience of the pain. Suddenly, marijuana doesn't make so little sense as a potential treatment for something. So these are things that research has shown that marijuana actually does. So we talked about the first three. It controls muscle pains, including muscle spasms, because it helps relax. That's why it impairs coordination. It can help with tics for exactly the same reason. So someone who has extreme tics from Tourette's, marijuana may be the thing that helps them not tic so much. And it reduces convulsions in some people who have epilepsy. It doesn't work in all kinds of epilepsy or all expressions of epilepsy. But for some people, I heard a story not too long ago of a young girl, I think she was 8 or 10, who was having 40 to 70 seizures a day. She couldn't go to school. It was beginning to cause some brain damage. And they tried marijuana with her. And her seizures went down to 4 to 5. And she's now going to school, although she has some significant learning issues now. She's getting special education, and she seems to be doing really well in advancing. Is marijuana good or bad for her? I don't think it's complicated at all in this case, right? There may be complications, side effects that we need to deal with, but it's clear in her expression of her disease that this had a positive beneficial effect. So if we begin to think of medicines like OxyContin that help us alleviate pain, and drugs like OxyContin that we use to harm ourselves, and we separate out those things, we can begin to destigmatize stuff that is medicines that's also potentially abusable. Now, there's a whole bunch of other stuff that marijuana is in the process of being studied for that we don't have empirical evidence of efficacy yet, but again, kind of makes sense, and so these studies become really important. MS, heart issues, like a slow heart rate, because marijuana speeds up your heart rate, maybe that would be beneficial for that. Chronic obstructive pulmonary disease. Guessing it's not smoked marijuana for that one. I've never seen that on that list. That's funny. I've presented this several times. All right, so we don't have evidence of those, but it is being studied for those now. Now, in addition to the plant form of marijuana, which is what we've been talking about, there are synthetic formulations that are available, and we'll talk about the benefits and negatives associated with these. In this country, we have 2 formulations that are approved. Dronabinol, which is sold under the trade name of Marinol, is FDA approved for people with HIV, particularly for wasting syndrome, nausea, and appetite stimulation. And Nabilone, sold under the trade name of Sesamet, is FDA approved only for cancer, but it is being used off-label for HIV as well. So this one's being used off-label for cancer, and that one's being used off-label for HIV. There are other formulations that are available, but they're not available in this country. They're not FDA approved in this country, although we have heard occasions when people have smuggled them in. So these are approved in other countries, but they're not currently available in this country. So these THC medicines still have psychoactive effects, so you could still potentially abuse them in order to get high. One of the things that's interesting is that I told you that marijuana has a whole bunch of compounds in them. Some of those compounds in the plant formulation actually attenuate and mediate some of the psychoactive effects. They're not present in the pill formulations of THC, and therefore people will often experience too much high from the pill form compared to when they use the plant-based form. So they may be too strong. So to get it up to a clinically effective dose for pain, for instance, they may feel totally wasted and like they can't leave the house. Whereas if they smoked a joint, they would have pain relief and not feel totally wasted. Isn't that interesting? And medical marijuana is cheaper. Go figure. It's not made by pharmaceutical companies. It's not packaged and sold. It doesn't have the advertising budget behind it. And Turns out, doesn't cost as much. So that's another reason why people like it. When you smoke a substance, it's the quickest route to your brain. It basically goes through your lungs right to your brain because your brain wants to get that oxygen or whatever else your lungs are carrying to your brain as quickly as possible. So you get instant feedback on how much you've been using, right? Is it working or is it not? You take a hit off of the joint, still feel a little bit pain. You take a smaller hit off the joint, pain seems to go down. You get pretty instant feedback, and therefore knowing if you've used enough for the desired effect is clear. Whereas if you swallow the medicine, it has to go through your gut, it has to make its way into your blood system. It's slow to onset. So people will go, I don't know, I took it a half hour ago and it's not working, so I'll take another one. And then they get blasted, right? Because they've taken a double dose of their medicine, haven't waited for it to become effective, and it doesn't have those attenuating chemicals in it. So they've taken a huge dose of something that's really pure THC, and they feel totally wasted and they can't leave the house. Which is better? It's complicated, right? Medical marijuana is not FDA approved. This is in response to, is a little bit good. We can't really tell. So it's not tested safe and effective by the FDA, and you can't evaluate how much medicine or drug is in the plant because there's no standard medicalized formulation. And let me just ask you, is this the same dose as, right? And yet two different users, that could be the way they dose their marijuana. I won't tell you how I took it when I wasn't smoking. And it's different everywhere. I showed you the sort of increase in THC that happens in the marijuana plant. But the plant grown here is different than the plant grown in Hawaii, which is different than the plant grown in Mendocino, which is different than the plant grown in Southeast Asia. How much are you getting? Who knows? Smoke some, see what effect you get, smoke some more if it's not enough. That's how people dose themselves. And it's not controlled in terms of how it's produced. And so it can have funguses or mold or other pesticides in it that you're also smoking along with the marijuana, and therefore exposing your lungs to potentially dangerous substances in addition to the smoke caused by the marijuana. And it's just hard to say that a medicine that's smoked is good. I don't think I have any more to say about that. So advantages of medical marijuana. The chemicals that moderate the psychoactive effects make it good for the indication without being too intoxicating. It's less expensive. You get more immediate relief with the instant feedback of whether or not you've used enough or not. And it's less erratic in terms of its absorption than when it has to go through the gut. On the other hand, the medicines are FDA approved. You get the same amount in every dose. We know that it is what it is and not something else. You don't have to smoke it, and one dose is one dose is one dose. And so over time, hopefully, people can learn not to over-medicate themselves and how long it takes for it to become effective. Thank you, I love this question. We often hear that marijuana is a gateway drug. If you use marijuana, you're gonna end up smoking cocaine, then you're gonna go right to the horse, right? There really is no evidence for this gateway concept. What there is evidence for is that people keep experimenting with what they can get until they find the thing that works for what they want it to work for. So what's most available in our society, and if you want to relax or get high or forget your troubles? Alcohol. So people generally start with alcohol. Or nicotine, go figure. Those of you who smoke, yeah, it's a drug. Oops. They then move on to the next most available substance, which we've already identified, which is marijuana. And if that works for them, they're unlikely to go on and try something else that's seen as a harder drug and is more difficult to get. But if it doesn't, then they'll progress to other things. And so there seems to be this concept of a gateway process where you go from one to the other, but it's really availability more that's determining that. And when you factor out those kinds of variables, turns out there's no evidence for a gateway at all. So if we can teach people appropriate coping, maybe they don't have to go in search of chemical means of dealing with that, or we can get them a medicine that will deal with real chemical imbalances so they don't have to go searching and being chemists on their own. So when we're looking for medicines, we're generally trying to cure disease or ameliorate disease process in some way. And stimulating creativity, while it may be important to someone's livelihood, probably falls under that illegal spectrum of use, because it is not treating a medical condition in that way.
But is there anything that you say that there's a reason not to smoke to help your creativity?
Well, I would, again, as with everything, someone who's using alcohol and they're using a little more than I'm comfortable with as a provider, I'm going to look at functionality. You know, what's good about using your marijuana? We hear all about the creativity, we hear all about those kinds of things, and what's not so good. And that's going to tell us what we can do in order to begin to move them toward other ways of stimulating that creativity. Exactly, motivational interviewing. Yeah. But if you look at, you know, which is more harmful, one joint or one cigarette, it turns out one joint is more harmful than one cigarette. In fact, it takes 4 to 10 cigarettes in order to equate the potential damage that you're causing yourself from that one joint. So the data is good. I wouldn't have cited the study if I didn't believe the study after I read it, but I just don't remember all the details of exactly how they did it. I apologize. But generally what we're seeing is the difference between that immediate feedback and the delayed response, and then managing the dose so that you don't end up over-intoxicated in order to get the medical dose. And so a lot of people say that marijuana works better because they can control how high they get while still getting the pain relief because of those other compounds that are in there. That's my clinical experience. Take it for what it's worth, because we don't have data. What we're really talking about is the oils out of the plant, generally when we're talking about tinctures. And so what we're talking about are compounds that are like hashish or hash oil that are drawn from the plant. So they're more concentrated than the direct plant-derived route of administration. But in terms of what's in it, the compounds are exactly the same. So you need less in order to get the same high. They're making synthetic tinctures. That's exactly like K2, spice, those sorts of things are purely synthetic manufactured compounds that operate on the cannabinoid receptors and really honk you up in a variety of different ways. So there are synthetic compounds that are available that mimic the effect of marijuana, and that's probably what you're referring to. The things that are commonly referred to as spice or 2K. The issue of cross-addiction, and they'll downplay their marijuana use and upplay the other use and say, I really need to address this, but I don't want to address that. Am I understanding the question correctly? We can't talk about reducing the harmful effects that people cause themselves while we move them toward a better lifestyle. And what we need to do is address the person from where they are. And if they're using cocaine and marijuana, I'd rather they keep using marijuana for a little while and stop using the cocaine, which I know will kill them in a variety of different ways, probably quicker than the marijuana will. Or if they want to stop the marijuana and they keep using cocaine. Am I happy with that? Not really. But is it a good place to start? Absolutely. And sort of thinking about, what is this person willing to do now that I can address, and how can I move them in the right direction? We keep them engaged with treatment, and we keep them moving in the right direction. We increase the likelihood they're going to end up alive at the end of that. If we go, no, you have to stop everything now, they say, thank you, it's been lovely, and they leave. And we lose them to everything. And so I am fully in favor of meeting the person where they are and moving them down a path that leads them to a happy, healthier, more fully functioning life. That's really my recommendation. Is there any evidence on secondhand smoke and marijuana? Only when I've been to a Grateful Dead concert. And I can tell you, I came away high as a kite and didn't smoke a joint, right? There's a study, thank you very much. She says there's a study that CBD is helpful for Alzheimer's disease. So there is some gathering evidence, thank you very much, that there does seem to be a difference. Yeah, and they said the same thing about indica and sativa for a long time too. What we need is to be able to study it in much more ways, and that's a really interesting study, and maybe you guys can get together and share that resource with him as well. Thanks. Wish I could say more, but I can't at this point. How can marijuana be a medicine while it's still illegal? Answer? It's complicated. You still haven't figured it out yet. You'll get there by the end. So the Controlled Substances Act in 1970 said that marijuana is a Schedule I drug. Schedule I drugs means they have no medical purposes whatsoever. There is no accepted medical use. And that there's no distinction in the eyes of the federal government between medical and recreational use. So if you're caught by the feds with marijuana, you can get up to 1 year in federal prison and a $100,000 fine for the first possession offense, and up to 5 years in federal prison and $250,000 fine for a first manufacturing offense. So if you're growing your own pot at home, you're manufacturing. And in California, that's legal within a certain limits. But it's not legal federally. You'd be manufacturing and liable for the 5 years in prison and a $250,000 fine. Well, this can't be right. The state said it was okay, so let's take it to the Supreme Court. And the Supreme Court said, yep, we like the old laws. There is no medical excuse for breaking the law. The law is the law, and if you don't like it, someone needs to change it, but right now, it's illegal, according to the federal government. So smoked marijuana is not considered medicine ever. That was first affirmed in 2001 and reaffirmed in 2006, and there's been no other federal comment since that point. So state law be damned, federally, marijuana is illegal. End of story. Now, you can use marijuana legally. For instance, if you're doing an investigational new drug study, the study that you talked about with Alzheimer's disease, for instance, they went to the federal government, the DEA actually, and filed an investigational new drug application and got permission to give people marijuana in order to research it. Now, there was also this program that was run for a while where under 100 patients were given marijuana in this program so they could follow them across time. A large number of people with HIV and AIDS applied and were able to get government issued fairly pure marijuana for a long time. But the program was shut down in 1992 due to high demand. There are still I love that line. There are still a number of people, though, who are on the program. It was no new enrollees were allowed in, but they continued the program for people who are enrolled, and they still get shipments of marijuana to their home, courtesy of the federal government. The pill formulations are approved by the FDA, so they're not illegal. In 92 and in or 85 originally, and then approved for HIV in 92, and in 2006 for Sesamet. 18 states and the District of Columbia allow for use medicinally. These were done through votes in the state legislature or through ballot measures that said, yes, we want medical marijuana in our state. It's weird to make medical decisions by ballot measure, isn't it? So it's fairly unorthodox to use the political process in this way. Normally, we create medicines through scientific trials and showing efficacy. Over 200,000 individuals in California obtained marijuana through medical marijuana dispensaries. In 2010, 69% of medical marijuana users were in California. Welcome home. In California, the Compassionate Use Act of '96 was approved by Proposition 215 by 56% of California voters. It amended previous legislation. It was the first medical marijuana law and led to lots of interpretation. But basically, marijuana is legal according to state law for use for recognized medical purposes as long as the person gets a recommendation for that from a physician. The problem is when they first opened up all those places down on Venice Beach, there was a sign that I have a picture of somewhere, and I tried to find it for this presentation. It said, medical marijuana cards here. Get a card or we'll give you $25. How many people did they turn away? It's on Venice Beach. So the Compassionate Use Act removed state penalties for use, allowed for possession of small amounts of marijuana for personal use, 8 ounces of dried marijuana or 6 mature plants. And then the California Medical Marijuana Program administers the Medical Marijuana Identification Card Program. It's voluntary, you register, And then the intent is to help law enforcement make sure that only people who are supposed to be getting the card for medical reasons are actually getting the card for medical reasons. I ultimately think that's going to fall to our responsibility, however, because if someone's got a medical marijuana card, we have to begin to think of it like a prescription for opiates, right? Is it good for the indication that they're talking about? Do we think they're getting good medical care overseeing that? And are they using it in the way that was medically recommended? And are they having any kind of dependence problems associated with it? If any of those are the answers to any of those are problematic, we need to refer them to a good medical provider who could make an assessment about whether or not this is the best treatment for them. Eyelash pain, by the way, not a good one. Doctors don't prescribe, they just recommend, so they don't control the number of refills, the amount that they get, the route of administration, or anything else. The dispensary staff helps patients with that determination. How much it takes to get a card, $40 to $100, varies considerably. Again, people can grow it or they can get it from a dispensary. And the doctor who recommended it doesn't have to have any ongoing relationship with the patient. They can say, yeah, you probably need some marijuana, have a nice day, and never see them again. So unlike blood pressure or unlike anxiety that's treated through the regular medical system, there's always some sort of medical follow-up that happens. That doesn't exist with this because it's falling in that legal netherworld. I don't have the picture for statewide, but these are dispensaries in LA County. We had more than anybody else, so I thought it was an interesting picture. Thousands of unregulated dispensaries still in operation, even though they've tried to reduce the number significantly. Many of them offer delivery service as well. So most drug arrests are made by local and state law enforcement who enforce state laws. And so state law officials know that certain amounts of marijuana are okay. But if you happen to come to the eyes of the federal government and the feds arrest you, you are subject to federal law. So you could be doing something that's entirely legal, carrying your marijuana home from the dispensary, and go to federal prison for that. Many providers don't know that. Many patients don't know that. So this education becomes really important. It's rare. It varies depending on the political climate that they make these kinds of interventions. But the feds did come into California, particularly LA County, and say, way too many dispensaries, you need to reduce those, and begin to look at how to get the state to reduce the number of dispensaries that were out there, for fear that they're profit-making enterprises. The Supreme Court ruled in 2005 that federal law takes precedence over state law, as is often the case. And you can be charged with a federal marijuana violation while obeying state law. Again, it's rare, but it has happened. The Supreme Court also ruled some protections for physicians, however. They cannot investigate a physician just because they recommended marijuana to a patient. And so because they're following state law at that point, the feds are recognizing and allowing that flexibility into the system. Yeah, we killed that one. There's one other thing related to the legality of marijuana that I thought was really interesting, and that is what's legal is not always legal, and what's illegal may be dependent on a lot of factors. If you have a medical marijuana card and you get a drug test at work, can they terminate you if you have that card? I think officially, I'm not a lawyer, I don't play one on TV, but I think officially, according to California state law, you should not be terminated for that. But does that mean that either the employee or the organization is protected if that firing happens? I really don't know the legality of that. And again, I think the answer is it's illegal and illegal at the same time, which makes it complicated. There is no state-issued card. There is no prescription from an MD. There is a card that makes a recommendation for marijuana use. That's all. From a physician to a patient. But it is not a prescription, and it is not a state-issued card. 95% of Californians who use medical marijuana were using before they got the recommendation to use medical marijuana. And remember that recreational use can evolve to medical and vice versa. And we saw that a significant portion we're using for both fun and for medicine. I used to use marijuana with friends. This is from a study a qualitative study that was done out of our group at UCLA. I used to use marijuana with friends going out to concerts or some event or party, but recently I got medical marijuana for anxiety and depression. And now it's not necessarily recreational. It's more to deal with anxiety and depression. People often prefer medical marijuana instead of prescriptions, as we've already talked about. They use it in place of a prescription or believe that marijuana is more effective. This guy said, I was taking all the prescription medications, I was shaking constantly, and I was taking a medicine for a side effect to counter a side effect. Marijuana helped him with that. People often use medical marijuana as a substitute for alcohol or other drugs. You can see about 40% use marijuana in place of alcohol and 30% in place of other drugs. So they're treating their drug dependence with marijuana. Is that a good idea? It's complicated, right? Here's the reasons why they use. Self-reported users for people who are getting their marijuana from a dispensary, most common pain. Then you see some others which are potentially problematic for reasons that we've talked about. Then some that we know have worked. Yeah. People are making a lot of that stuff up. Yes, these are their self-reported answers based on them coming out the door of a dispensary and talking to an interviewer. Yeah. Yeah, 15-year-olds are using medical marijuana for pain, and some of them might have pain. So again, the disorder that they say that they're treating, you see how it rates down. Interestingly, two of the ones that we know, sort of there's medicines approved for, very low rates of people who are using medical marijuana for those particular indications. So what to do when it's a problem? We're at 12 after, we officially have till 12:30. I'm gonna go about another 7 minutes and then we'll be done. So we need to screen for signs of tolerance or dependence. Okay, we need to figure out, do they have a diagnosable substance use problem on marijuana? These are signs of tolerance and withdrawal, as well as the other signs of dependence. Remember, just because they have tolerance doesn't mean they have a problem. It means their body's gotten used to the presence of the substance on board. Are they messing up their life in some way? If the answer is yes, and they have a couple of these kinds of symptoms, then we know their use has moved on to problematic levels. So the recommendation is really that we think not in terms of stopping use altogether, at least initially, particularly if they're sold on the medical benefits of this, but to use motivational interviewing to figure out what is going on with them, what is working and functional for them related to their marijuana use, and what kinds of negative impacts is it having. And so if you're trained in motivational interviewing, do that. If you're not trained in motivational interviewing, I have 3 little steps you can do, and if you just do 1, 2, 3, you'll start a conversation with the person about their marijuana use. And the first step, by the way, this is the best clinical tool I've ever been given. It'll write a treatment plan for you. So I use it in everything. So it's my gift to you. You're welcome. Explore the pros and cons of the current situation. What's the current situation? Well, it's marijuana use. So what are the good things about using marijuana? What are the functional things? And what are the not so good things? Not labeling it bad, but just figuring out what the negative consequences are. By the way, sometimes we have to go way far and like, you know, marijuana sounds great and like it's working really well for you. Is there anything that's just that much icky about it, right? Just that much not so good. And people go, no, well, I have to use my inhaler 12 times a day, but that's not so bad. And they'll go on and they'll tell you devastating things as long as we give them space to say it's only a little bit not so good. Then, what would be the good things about no longer using marijuana? And what would be not so good about no longer using marijuana? So this is what they get from using marijuana, and this is the cost that they pay. This is what they'd like to get if they were going to stop, and this is the cost that they don't want to pay in order to stop. Your whole treatment plan is written. Again, you're welcome. We then give them feedback. And in motivational interviewing, the way we give feedback is we involve the patient in the process. We say, I'd like to give you some feedback. Would you be willing to hear it? If they say no, is that okay? Yeah, it turns out they're not going to listen to you anyway if they don't want to hear it. So you might as well not say it. So by involving them in the process, you get their buy-in to at least hearing what you have to say. And then you give them a summary of what you heard in the decisional balance. The pros and cons, your concerns associated with their use, and make sure that you do this in the most non-judgmental way that you can, just giving them the feedback about what you heard. And ask them their reaction to your feedback. So the sandwich is, involve them by getting their permission. The meat, give them the substance. Involve them by getting their reaction to your feedback. Once you've done this, you'll know whether movement is possible or not. You're using your inhaler 12 times a day in order to keep using your marijuana. Would you be willing to try cutting back 30% on your marijuana use and just seeing what that does to your breathing? Would you be willing to cut back 1 joint a day on your marijuana use and see what that does to your breathing? What steps might they be willing to take to move them in the direction that we want to see? Notice I haven't said you got to stop altogether because you're going to die from an asthma attack. They're going to go, thank you very much, and leave and not do anything. But could we get them to commit to one small step? So we're going to look for behavioral interventions that they may be willing to take. We're going to look for alternate pharmacologic interventions that they may be willing to take. And we're going to look at potentially replacing smoked marijuana with the pill form of THC to see if that might be impactful. And then I gave you a whole series of slides that said, if they have this, what else can we do about it? So if they have anxiety and depression, for instance, we don't have a biological test, so we just have to ask them and observe them to see if they have anxiety or depression. And then treatments that we know work empirically are psychotherapy and group therapy and a variety of different medications. Is it appropriate if someone's using for anxiety or depression to add one of these on board to see if that would impact their need for marijuana overall? Might be an alternate strategy. So I'm not going to go over all of these in detail because you can download the slide and they're pretty self-explanatory. If they're using it for nausea, give them anti-nausea things, including medicine, as well as when to eat and stuff to alleviate nausea. For pain, some non-pharmacologic ways of alleviating pain. Did you know that people experience significantly less pain on days when they do something that they enjoy? Isn't that interesting? My brother was run over by a semi about 25 years ago while he was riding a motorcycle. By the way, it's a bad idea. He's still ambulatory, but it crushed his pelvis and he has chronic nerve pain that in varying degrees of success in treating. He's also a really fine oil painter, and he'd given up oil painting for 10 years. Did it for a long time, gave it up for 10 years, and has recently started painting again. His pain is about 50% of what it was before he started oil painting again. None of his medicines have changed. Go figure, right? I tell him I use him in these trainings, by the way. He goes, really? And I say, yeah, and he said, okay. So I have his permission. So again, some ways that you can treat pain with pharmacological agents as indicated. Again, these are generally medical decisions that need to be made by an approved medical provider in collaboration with you if you're not that. Sleep disturbances, and then some general issues related to, I just put a summary of the pill formulations that are available in this country. We've already covered all of the details there. So I'm going to take just a couple of questions. A large portion are replacing illicit drugs or other illicit pharmaceutical agents in her sample with marijuana because it's natural. Well, hopefully the information's been useful. Download the slides and you can see the rest of it. Sorry, I'll take your question afterward. Have a good lunch. Thank you very much.